Well, I'd like to welcome you, both the folks here in Wilsonville as well as around the state, to the 2017 ORIMHA Annual Members Meeting. Wanted to give you a brief orientation about what we're going to be doing today. I'm going to talk for a bit just about sort of the state of the organization, what we've been up to, our financial position, and then Paige is going to talk as the endorsement director about the endorsement and what's been happening and where's it going. And then we're very lucky to have Wendy Davis here, who will be doing a training for the last hour on promoting attachment with perinatal mental health in mind. So ORIMHA's core beliefs, including, is first of all about hugs. That's my daughter when she was about 20 years ago. But our vision is that all our babies are held in mind by parents, by our members, by policymakers, and that the ORIMHA mission is that we are a statewide network of parents and professionals developed to support the emotional health and well-being of all of Oregon's infants, toddlers, and their families. Paige, can you help with whatever that is? So I used this slide last year, and it still applies this year. There is a lot going on for ORIMHA. I thought I'd give you a sense of what our board has been up to. We did a strategic planning retreat and follow up to that. We revised our bylaws. Those are available on the website if you want to look at those. We hired a bookkeeper to help us manage all the grant money that's been coming in. We did a website redesign and a new logo. And we have some new board committees, including finance, board development, and advocacy. And we have expanded our geographic representation of the board to include members from Southern Oregon, from Eugene, and from Yamhill County, in addition to the Portland metro area. Because we really want to be an organization that represents the state. We know that the issues in Portland metro area are not necessarily the issues in other areas of the state, especially in the rural areas. So these are your current leaders and current committee chairs. You can see that Pam Skyver is chair of membership, Nan Leroy for professional development, who organized this training. I want to give a shout out to her and her committee for organizing this. To Paige Light, who you'll hear from later, for endorsement. Susan Fisher from Southern Oregon for board development. Zoe Linsmeyer from Yamhill County for advocacy. And Jessica Hall as our new treasurer and chair of the finance committee. So training activities. Back last year, at the end of it, Kathy Bobula did a webinar on the neuroscience of attachment. And then Paige and Angelica Molina Alvarez presented at Southern Oregon's chapter of OAEYC in February on implementing mental health principles, strategies to enhance attachment, and then healthy social emotional development in infants and toddlers in Spanish. We, of course, have today's training, and then we are planning a large full-day training for the fall, and stay tuned for more details on that. We hope to get that planned out in the next month or two, hopefully. And currently we have, for this 2017, we have 309 members so far renewed or new, and we expect to add to that. And we currently have 14 organizations across the state that are organizational members. In terms of grant activity, in addition, well, I might have put this in a different order, actually. I'm going to come back to the first bullet. We're in the second year of a 3-year, $240,000 grant from the Ford Family Foundation to ensure that endorsement is rolled out not just in the Portland metro area, but to rural Oregon for professionals all across the state. We also have the, I'm sorry, I'm getting myself confused. The first bullet is the renewal of our grant from Oregon Health Authority using McPhee funds to support the endorsement. And that will wind up at the end of September, which will be important for us because it'll be the first grant that's ended, and we'll have to think about what we're doing with our money to support endorsement when that grant runs out. We do have a new grant that's starting. It's a 2-year, $50,000 per year grant as part of a 4-state collaboration with the infant mental health associations from Alaska and Washington and Idaho to promote reflective supervision in that 4-state region in combination with the state agencies from those 4 states. And so that's still getting planned out. We'll be hiring folks within Oregon or reflective supervision leaders to help with that. And there will be a reflective supervision conference in Washington in early August. And we'll have more details for that, but that will be a really excellent conference that we'll be helping to support. And we're also doing more collaborations. We now have a memorandum of understanding with Healthy Families Oregon that they will encourage all the healthy family programs throughout the state to promote infant mental health endorsement. So that means encouraging their contractors, for instance, to use infant mental health endorsement as a factor in hiring or a factor in promotions. This is a nationwide push that Healthy Families is doing, and we're happy to be part of it. A new memorandum is with the Oregon Post-Adoption Resource Center, and we're going to be creating an infant mental health lending library, which will be a benefit specifically for ORIMHA members. ORPARK already has a lending library for adoptive families and DHS folks, and they have a great system set up for books and materials being sent out postage free with return postage already paid. And we reached an agreement that they will use that same system for our books. It's starting off with a donation of almost 50 books, and we're going to be soliciting other donations and trying to grow that library over time. But a lot of folks, just want to look at one chapter in a book. Yes, they could order it from Amazon, but funds are tight. And if you can get the book and look at it and make a copy for your personal use of that one chapter or whatever, it can be a much more efficient use of resources rather than having to buy it. Or if you just want to preview a book and have it in your hands for a couple weeks and really look at it, and do I want to buy this? Books are expensive these days. And so it's another way that we're trying to spread information to our members and be a benefit. So that's something that's coming. We just finalized that agreement, so the library isn't up and running yet. We have to get the books over to ORPARK, and they have to catalog them and get them on their website and get them shelved. So it's going to be coming in the next probably month or two. So there's some startup to do with that, but wanted to let you know about that breaking news, and it's not fake. So Jessica Hall, our new treasurer, couldn't be here today, so she asked me to deliver the treasurer's report. And in terms of our income, you can see that most of our money right now is coming from the 2 current grants from OHA and from the Ford Family Foundation. And we have other income from endorsement fees and membership dues. And then we have expenses, of course, both for the Oregon Health Authority in terms of staff time, paying for scholarships for reflective supervision groups, or scholarships for endorsement fees. Those same sort of expenses come from the Ford Family Foundation, paying for staff for the endorsement coordinator as well as the endorsement director. And then we have business operations, which are things like our bookkeeper, our liability insurance for the organization, expenses like that, some postage. And so you can see that right now for 2016, we got more money in than we spent, which is a good thing. And our ending balance is close to $80,000. I think that will shift some in 2017. We're planning to spend at a higher rate in the Ford Family Foundation budget than we did this last year. So I doubt I think we'll probably spend more than we take in 2017, and that's okay. I mean, it should even out in terms of the 2-year period of 2016 and 2017. So what Paige and I agreed is that we're going to take questions for both of us, either from you all here in Wilsonville or from around the state at the end of our presentations. And so you can hold your questions until that point. And I'm going to hand it over to Paige, who is going to tell us about endorsement.
Thanks, Redmond. I'm going to do just a little system check. So it turns out that I can't see anyone's comments when we have the slide up. So I'm going to take the slideshow down for a moment and just check and see if there's any comments from people. Well, yeah, I think these are all the ones that we already saw earlier. We had 9 before. So I think we're good with that. I'm going to go back to my share screen and stand up and talk about, I lost my spot. Where I want to start. Here, there we go. Talk about endorsement. I want to talk a little bit about the Alliance for the Advancement of Infant Mental Health. They used to be called the League of States. So if you heard me talk about them last year, they were called the League of States. This is an organization that has recently gained their own 501c3 status and is made up of membership of all of the states, actually including Australia, who have purchased and are using the current endorsement license. So we're all members of the Alliance for the Advancement of Infant Mental Health. Here are some of the benefits and information about that. Infant mental health is growing across the country and internationally. West Australia has the same license, and the other 3 provinces in Australia are currently interested in pursuing. We have 26 states. We have 6 more in the discovery phase. So we're more than half the nation has this endorsement and growing. It gives us lots of opportunities for sharing resources between states, lessons learned as people are rolling out endorsement, and connection to other folks. The Alliance Retreat is a benefit of being a member. Once a year, leaders, 2 or 3 leaders from each state meet for a 3-day retreat to talk about how things are going in their state, to do some training and connection. Redmond talked about the annual Reflective Supervision Symposium that's coming to Seattle this year in August, in early August. The very first ever one was in Michigan last summer. And there's going to be more and more opportunities for shared research and for participating in research as this group grows. Currently, there's a membership survey in process from Arizona State University. If you are on our mailing list in any capacity, you will have gotten an email asking you to participate. Please go and look for that and do that survey. It's going to help all of us. I think there might be 10 states who participated, and so the Arizona State will be collating and making sense of all that data for all 10 states, but then also sending us back information about what's happening in Oregon and what our members are saying about the endorsement process. Here's the map of just the United States, which states have the same endorsement we have. A benefit for folks who get endorsed is that endorsement is reciprocal. So if you are endorsed at any particular category in any of these states and you go to another state, your endorsement just transfers over. My experience in the 2 years that we've been involved with endorsement is that these 6 states, 3 of them will become green next year, and there'll be 3 more blue ones. Endorsement in Oregon, we currently have, we started July 1st, we kicked off in June. We currently have 16 professionals endorsed, 8 of them, well, actually, 6 of them were endorsed by Michigan as part of our leadership cohort. 2 of them were previously endorsed, and we've endorsed 8 more since then. We have additional 85 professionals that are in the endorsement process. They've registered, they have online portfolios that they're working on, or they've completed their portfolio and are finishing up some other part of the requirement. Those 85 professionals come from 25 different counties. So one of our goals with the Rural Oregon Infant Mental Health Endorsement Initiative, which is funded by the Ford Family Foundation, is that we spread endorsements statewide and that rural participants have equal access. We have submission dates every 3 months for infant family associate and infant family specialist applicants, and every 6 months for infant mental health specialist and infant mental health mentor applicants. And we just administered our first exam, which was a big deal because we had to get trained in how to score it and review it. Here's a map that I did on January 1st of where folks had registered. So far for endorsement, since I made this map, we have added Curry at the very bottom. We've added Curry and Josephine. We've added Klamath, and we've added Crook. So that's great, and I'm excited about it. We have a good spread. We're working on getting outreach to the other counties. This is a map of who's endorsed and where they are, the locations, and then the categories that people have earned endorsement in. You can see there aren't very many red or yellow dots. Part of that is because we didn't start accepting applications for infant mental health specialists and infant mental health mentors until October 1st. So we've only had 1 cutoff, and it was after this date. At the end of next year, we will have had 2 full rounds of accepting portfolios from those categories. Since I made this map, we've added someone in Coos County. There's 2 more folks who have been endorsed. There's a couple other folks who are still in process of review now. We have expanded our contractors through our grants. We added a position to the leadership team. Allison Hinson is now our endorsement coordinator. That's a role that I used to have. I've transitioned into an endorsement director position. That enables me to do some more traveling. And now that we have 85 people in the system, Allison's doing a great job handling all the questions and helping folks with their portfolios. We currently have contracted specialists to support folks in 4 county groups, Allison Hinson's in Douglas County. She's also our endorsement coordinator. Hannah Stanfield is in Coos County. Angelica Kelly Ashton's in Malheur, Grant, and Harney counties. Tracy Colachico in Deschutes, Jefferson, and Crook. And Angelica Molina is our statewide bilingual specialist. You can find on our website under endorsement, under Rural Oregon, there's a list of all these folks and a bio and a photo and how to contact them, phone numbers and email addresses. We're still looking for rural endorsement specialists in these county groups. We hope to add 11 more contractors by the end of this year. So if you know anyone who's interested, if you're interested in supporting endorsement in your county, you can go to the website and look under jobs. We have a posting there, we have the job description there, or you can send me an email, or you can send an email to endorsement@orimha.org and get more information. Reflective supervision and consultation. We currently have 26 folks endorsed and or vetted providers of reflective supervision consultation. So There's 26 people who are currently approved to provide reflective supervision and consultation. We are doing vetting interviews all the time and adding folks to that list. The list is on the website under reflective supervision, and there's a PDF list. It was last updated, I think, in January, so we'll be putting a newer updated version up soon. We have currently 4 groups to provide reflective consultation for applicants who wanted to become endorsed and didn't have access to reflective consultation that met the requirements for the endorsement. I didn't say how many folks, but I think we have about 20 folks who are participating. The groups meet twice a month for 90 minutes. 3 of those groups are delivered through this format, a video conference. And 1 is delivered face-to-face in Douglas County. And then the group leaders meet monthly for their own reflective consultation through Zoom. We also have scholarships, and those groups are funded through scholarships. We also have scholarships available for rural providers who are seeking endorsement to pay for their application and registration fees. And we have a limited number of scholarships available for folks who work in urban areas, who work for a nonprofit, a government agency, essentially any organization besides a for-profit organization. So through the Oregon Health Authority. I think that's the end of my update. I am gonna log out of the PowerPoint so I can see questions. We'll take questions from the room, as well as if folks want to write in questions. You can write questions in Q&A, which I think I have to go log out of my other computer to see. So how about in the room? I'm going to turn it to you, Redmond.
Okay. Any questions from the assembled masses here in Wilsonville?
I have a question about the lending library.
Yes.
Where are you getting the books?
The initial donation of almost 50 books is from actually my own personal library. But folks who have duplicate copies or books that you're not using anymore, we would like to build the library. The books I'm donating have my own personal skew to them. They don't necessarily cover the broadest realm of infant mental health. There's a lot of books about psychotherapy with infants and toddlers, but not necessarily childcare consultation or home visiting. So we want to build a library that is broad and covers lots of different areas of infant mental health. So it's just a beginning. And partly in addition to donations, we'll also be looking to write some small grants to buy books for that library also. Mm-hmm. Anything from around the state?
I can't get my questions. We're having a little technical difficulty because I'm not logged in, but I think you can send a chat. So if you have a question, use this button at the bottom, this chat button, and we should see that. I'll send it. You can. There. That's going to work.
Other questions?
I have another question.
Great. Thank you very much, Leslie.
I'm wondering if people are wondering if or how they get connected up with a group if they want reflective supervision. How do they
get connected with a group?
Yeah.
They would need to be pursuing endorsement. So they could contact me. They can turn in a scholarship application. which are on the website to become endorsed. And right on the reflective supervision line, there's a line that says, where have you gotten your reflective supervision line? Under the provider, they can write, I would like to join a group. And then that scholarship will count for both the group and for their endorsement fees.
Have you been able to cover everybody so far? Who's asked?
Yes. We have one participant who's looking for a group at a different time. But other than that, thanks.
Good job.
Maybe
Here's a question. Could you talk about our future expansion of our presence on our website and social media? From Kathy. I think that one's for you.
Okay. So we recognize that our website has a lot of information on it. It's a challenge to keep it updated. And we don't have much of a social media presence. We don't have a Facebook page. We don't have other ways that people can connect to the organization and get information back from it. And so that is one of the priorities for the organization. We are currently, as you may have noticed when I did the slides for officers, that the vice president position is vacant. One of the things the board decided was that we, in addition to sort of backing up me as president, the vice president position would be someone who can bring skills around doing social media and website maintenance and development. Sort of a techie as well as infant mental health person. And so we're currently doing a search. You may have seen an email asking for people interested in the vice president position. And so we're currently doing a search for that. If you are interested, that search is already happening. So I think it's not too late for you to put in your interest, but you should do that very quickly, like in the next week. But we're hoping to get a new vice president who could be more active in doing the social media and website, keeping that updated and bringing new content onto it.